Compassionate communities are where the community works together and understands that caring for one another through the ageing journey is not a task solely for health and social services. Sometimes it can be difficult to make new social connections, but Health Connectors and Wellbeing Connectors are here to help. Paul recently retired and lives alone. He visits his doctor to get a repeat prescription. The doctor notices that Paul seems lonely and down. The doctor refers Paul to a Health Connector in their practice. Paul has an appointment with the Health Connector and they discuss his interests and the people in his life who are important to him. Paul tells the Health Connector that his wife passed away several years ago and his daughter lives overseas. Paul lived for work. This was his whole social life and most of his friends were connected with the business. The Health Connector uses the My Health Connector website to discuss activities Paul might be interested in. Paul is happy to try the local men's shed and a walking group. He agrees to give some of these activities a go. The Health Connector makes a follow-up appointment with Paul for a few months' time. When Paul next visits his doctor, he shares that he enjoyed the men's shed and reconnected with some friends he knew years ago. Paul goes to the men's shed regularly and meets up with his rediscovered friends and enjoys other activities. Joan visits her local general practice to see the practice nurse for a vaccination. The practice nurse, who is also a Health Connector, notices that Joan seems sad. Joan's husband Barry, who has dementia, has recently gone into residential aged care. Barry used to do all the driving. Joan feels worried as she hasn't had to go out by herself for many years. Joan has a follow-up visit with the Health Connector to have a longer appointment. Together, they look at the My Health Connector website for potential activities Joan could consider. The Health Connector offers to call one of the activities, but Joan is still unsure and needs more support. The Health Connector offers to set up a meeting for Joan with the Wellbeing Connector, who can provide the support she needs over a few appointments. Joan meets with the Wellbeing Connector and they talk about her interests. Since Joan was a full-time carer for her husband, she didn't have time for social activities. The Wellbeing Connector suggests that Joan tries a local dementia support group and a coffee club. The Wellbeing Connector talks with Joan about what to expect when attending these groups. They also discuss transport options. The Wellbeing Connector supports Joan by attending the first group with her. This way, Joan doesn't have to introduce herself to people she doesn't know. A few months later, the Wellbeing Connector follows up with Joan and finds that she regularly attends the dementia support group. Joan is much happier now she has some regular support. To find a health or wellbeing connector near you, visit myhealthconnector.com.au.